Hey guys, Dr. Chait here. So I get a lot of questions in the clinic regarding semaglutides like Wegovy, Ozempic, and I just want to give you some clarity. I know it's a big craze right now. A good majority of my patients are now taking Ozempic. So I've seen the good, the bad, and the ugly with it. And here I want to create a video. I'm going to explain to you what is semaglutide or Ozempic or Wegovy. And I want to create a differential or a contrast of comparing taking medications that allow you to lose weight or help you lose weight and doing it the old-fashioned way, earning it, right? So we're going to go over some diet, exercise, and look at some of the evidence and some of the research. And I'll go over some of my clinical experience so you have a deeper understanding of should you take semaglutide medication or should you just do it the old-fashioned way, which is diet, exercise, and lifestyle modifications. Now, of course, I'm an acupuncturist and a physical therapist, and I'm also a nutritionist and herbalist. So I'm going to be a little bit more biased, although I've seen great results with semaglutide in my clinical practice. And we're going to dive into this. And after going down my weight loss journey of losing almost 50 pounds about a decade ago and kept it off, there's some insights I want to teach you on how I did that. And there's a mathematical formula that I created that's easy to follow. And unfortunately, most people get confused, and it's not very confusing. There's 4 pillars. It makes it very, very simple. We need to eat well, move well, think well, and supplement well. So it makes it very, very simple. Now, why should somebody take semaglutide, or why should they take Ozempic or Wegovy? And that's a personal preference. So I'm not here to judge. I'm not here to make recommendations or anything like that. I'm just here to shed some light and have you a deeper understanding of what semaglutide medication are and what the benefits are and what the precautions and contraindications are long term. Okay, so let's dive in. Now, here's the formula that I wanted to show you. Now, this is a formula I've been using for the past 3 to 5 years, and you could use this in any light, but look at this formula. It's called the weight loss formula. Now, we could put health instead of weight loss, but we'll call this the weight loss formula. So weight loss equals action divided by identity. So what are actions? Actions are a keto diet, exercise, strength training. It's a tool or a tactic that you might have heard because there's hundreds of different lifestyle or diet changes that you could do on a like you look at the news, they say keto is the best way, paleo is the best way, vegetarianism is the best way. Take this supplement, take this pill, walk 15, 20,000 steps a day, do cold plunge, right? Those are all tactics, right? So I want you to understand those are tactics, those are actions, right? So what is identity? Now, identity is nothing but a belief plus a belief plus a belief. So countless cases, probably hundreds by now because I've treated 700,000 patients. I've had patients that have lost weight, and maybe you can see this, and this is probably you as well. You lost weight, and then the weight came back. So no matter what diet you tried or technology you tried, if you took a medication like Ozempic or Wegovy or a semaglutide med, which is at a compounding pharmacy, and you lost the weight, but then the weight slowly started creeping back up, right? So it is because, and this is my belief, that it is your identity, also known as lie identity. So your subconscious programs have conditioned you consciously or even subconsciously to stay heavy. Now, how many times have you lost weight and you looked in the mirror and you're like, I don't like the way I look. I don't like the way I feel. I still feel heavy, right? And that's what I'm talking about is we have an identity of ourselves, which is a belief pattern that sometimes we might have achieved our goal, but yet we don't like the way we look. So we still see ourselves as fat. So that's our identity. Now, here's how the math works. So I'm going to bust out this trusty little icon here. So if I had a poor identity, so I'm going to draw this down like an arrow down. So if my identity, my belief pattern is I can't lose weight or I'm always going to be fat, but I take a lot of action, right? What's going to happen to your weight loss? It's not going to change, right? Because you can take a lot of action, but if identity is divided by action, then you're not going to lose the weight. Now, let's do this. What if I changed my identity or my belief about me being skinny or fat, but I took a lot of action? What's going to happen to weight loss? you're going to increase your weight loss. Does that make sense? Now, what if I changed my belief pattern about my identity being skinny or fat, but I took very little action? Could you lose weight? And yes, you can. So if I changed my identity and I believed that I was skinny, you would actually start losing weight. So weight loss would go up. Hopefully that makes sense. Now, I have a weight loss mastery program that I do, and I teach you how to change your belief structures around your weight loss. I teach you the actions as well, because if I don't teach you the skill set and the tool set, and then you're not going to lose weight. And remember, 80% of weight loss is psychology, 20% is the tool or tactic. That's why you have hundreds of different diet plans and people have lost weight on it. It's because the action matters less. It's more about the identity you believe in yourself. Okay, hopefully that makes sense. So now, understanding semaglutides. So what is semaglutide? So a GLP-1 receptor agonist medication that mimics hormones that target areas of the brain regulating appetite. So it's an appetite suppressant. It slows the stomach emptying time and suppresses hunger signals. Users feel fuller faster. That's why you lose the weight, almost like fasting. You administer it. It requires weekly injections under medical supervision and prescription, and it's not available over the counter. Many of you guys know that. Now, what are the side effects? Now, a lot of you don't know this, that there's common side effects, there's moderate side effects, and then there's severe side effects. Common side effects, which I've seen in the clinic a lot: nausea, vomiting, diarrhea, constipation, abdominal pain. That's a very common side effect. Moderate side effect, I have not seen clinically yet, thank God, is kidney damage, hypoglycemia. Actually, no, I've seen that a lot in the clinic, and vision issues. I've also seen, I think, 3 cases of gastroparesis, which is the stomach actually becomes paralyzed. I've seen 3 cases of that. Pancreatitis, gallstones, and thyroid tumors. Thank God I haven't seen that. All right, but you have to know the risks of you taking this medication. And many users discontinue the use of these medications because of the side effects. And I've seen that in the clinic as well. What about diet and exercise? Already you probably know that diet and exercise is natural and it's cost you nothing, right? So a balanced nutrition plan consisting of whole foods, essential nutrients, and also appropriate calorie intake. We don't want to overeat or undereat. I see a lot of women that try to lose weight, and because they're undereating, they're not even eating 1,000 calories per day, they're not fueling their metabolism, so they hold on to weight because it's called weight loss resistance, and that's a workshop that I do. And regular physical activity, so you want to move more. So you want to eat less, move more, or eat more, move more. And then this is what I talk about: identity, behavioral changes. Benefits of diet and exercise: obviously improved cardiovascular health, enhanced mental well-being, and better body composition, so you get more leaner, and sustainable results. So the results by far, long-term, guess what wins? Comparing the effectiveness. So according to the clinical trials, semaglutide, most of the patients lost between 15 to 18% body fat or weight loss. Now, of this, which is interesting, I don't have that on the slide, I think the estimate muscle loss was also close to 30%. So of that 18% or 15 to 80% weight loss, 30% of that, up to 30% of that is muscle mass. Rapid weight loss initially, and it's comparable sides. So 15 to 18% weight loss in clinical trials, where sustainable weight loss for diet and exercise, 15 to 20%. So it's comparative. Rapid initial weight loss, and depending on your diet plan, it could be gradual at a healthy pace. But I've seen patients lose a lot of weight in a very short amount of time. So I don't really buy into that one. Significant weight regain when stopped. Yes, I've seen this. I've seen this in the clinic. My patients have lost weight for a period of time as they're on the medication, then fast forward, they put all the weight back on. It happens commonly as well on diet and exercise plans too. However, we can manage the maintenance much better on diet and exercise. Muscle loss alongside of fat loss up to 30%. It's pretty significant. So if you want to get lean and muscular, you're not going to do it using semaglutide, because you can lose the weight, but you also can lose the muscle mass. You're not going to get lean. Diet and exercise preserves or increases muscle mass, which is phenomenal. Semaglutide requires lifetime medication for maintenance. And exercise, diet and exercise creates self-sustaining healthy habits. So yes, for a lifetime. You can't just work out. It's like showering on a Monday and expecting to be clean on a Friday. It just doesn't work like that. Once you get into your ideal weight, because it's going to take some effort, it's almost like rolling a boulder up a hill. Much more difficult going up the hill, but then gravity takes over. And for you to keep your weight off and maintain your weight makes it much more easier. That's why I've been able to keep my weight off for the past. All right, lifestyle changes versus medical intervention. So medical approach relies on external solutions. So it's disempowering you. It may create dependency, and it treats symptoms, not the causes. Lifestyle approach, it builds internal motivation. It develops self-efficacy. It addresses root causes. And the cost comparison, medication, the semaglutides could cost you up to $1,000 per month, if not covered by insurance. Exercise is free. It's home. You have walls, you have outdoors, you have air to breathe, you can work out anywhere. Healthy eating is cost effective as well, unless you switch over to organic, which I love, and then the price goes up a little bit. But medications are definitely much more costly. So my question to you is this, guys. We're about 10 minutes into this workshop, this educational piece. What would you choose? Would you choose fast weight loss, which, who knows? Maybe you choose both. Choose semaglutide and then diet and exercise, and diet and exercise at the same time. Or you just want to go the natural route, and that's okay too. But it's totally up to you. I would make a comment below and just make a note. Let me know what you would choose. And if you like these videos, please comment, share, like, and invite your friends and loved one. I want to put these videos out once a week so I can help inspire, educate, and lead you guys to become better yous. So conclusion for diet and exercise: safety first, whole person benefits, sustainable process, or success rather, and personal empowerment. So here's to you guys. Sempre levante, always forward, and looking forward to your health journey. Take care. Bye-bye.